When do you need to get your thyroid looked at for a thyroid nodule? Or maybe you've had someone identify that you have a nodule on your thyroid. What do you do then? So the thyroid is a gland right here at the bottom of the neck that produces a hormone that helps regulate your metabolism. And some people have an underactive thyroid they have to take supplements for. Some people have an overactive thyroid that they also need medication or surgery for. But a lot of people will have thyroid nodules. Now, maybe you noticed a nodule on your neck and your physician thinks that it's a thyroid nodule and did an ultrasound. Or maybe you had a scan for something else. Maybe you had an MRI for your neck problems, or you had a CT scan of your chest or an x-ray and someone noticed a nodule on your thyroid. What do you do at that point? Well, the main thing that needs to be done when you have a thyroid nodule is to check your thyroid hormone level to make sure your thyroid is functioning normally, meaning you don't have too much or too little of hormone, and to get an ultrasound of your thyroid. That's a very easy procedure to get done, usually by radiology, but some physicians, such as ENTs or endocrinologists, may do the ultrasound themselves. It's a gel on the neck, a little probe that runs over it, uses sound waves to look at the thyroid. Now, you may have had a CT scan or MRI. Just know that the most sensitive and specific, meaning the best way to see the thyroid gland, is with an ultrasound. So even though you may have had a CT scan that suggests a nodule, the appropriate thing to do is to get an ultrasound. Well, the way we look at ultrasounds has changed over the last 10 years. There's a special criteria that the radiologist will use to score these, and it's called TIRADS, T-I-R-A-D-S, which is a scoring system that assigns points for whether the nodule is cystic, meaning it has fluid, or is it solid? Is the outside of it irregular or more kind of normal appearance? How big is the nodule? Based on the scoring of the nodule, it's going to tell us whether we need to do a biopsy of it or not. So many people have thyroid nodules. You can have multiple thyroid nodules. The thyroid likes to make them. We don't really know why, but it happens. And just because you have thyroid nodules doesn't mean there's anything bad or scary going on, but it's important to get it worked up. So the reason we want to do an ultrasound on your thyroid and to do the scoring system to see if it needs a biopsy. Well, why are we biopsying your thyroid? Well, we need to make sure that there's no evidence of a tumor or a cancer in it. Now, again, it's scary to hear the C word, but know that the 5-year survival rate for thyroid cancer is 95%. So as opposed to other cancers that are really scary if you get them, it's always scary to get cancer, but know that people do very well with thyroid cancer, and it's very easily treated with a surgery to remove half or all of your thyroid gland to cure it. Some people need treatment after that, but the main treatment for thyroid cancer is what's called a hemi or total thyroidectomy. Now, with the nodule, once you get it done, and if it looks like on the ultrasound that it needs to be biopsied, you'll then go usually to a hospital or an outpatient radiology center where they do what's called a fine needle aspiration. So they will, again, the radiologist will take the ultrasound, and I will mention that some ENT or endocrinologists will do this themselves. They'll take the ultrasound to guide a very tiny needle, not a big needle, a tiny needle into the nodule to take some cells from it and squirt them on a slide. The pathologist will then look at those cells and tell us whether it's something that's suspicious, it's benign, or they can't tell. There's actually a rating system that goes from 1 to 6. 5 and 6 are suspicious, 1 and 2 are normal, 3 and 4 mean we can't tell. In the old days, we actually would just say, well, there's a 20% chance there could be something abnormal or suspicious in these indeterminate specimens, and we would just take out half the thyroid. Now we have more advanced medical technology, meaning we can get a sample that's sent off to pathology, and they can look at the genes in the sample. And if there are a lot of genes that are more likely to show that you would have cancer, that will be rated that way. And I can then counsel you to say, hey, there's less than 4% risk of cancer. We don't need to do anything but watch this with ultrasounds every year. Or there's a high risk of cancer. We need to take this out. So that's what happens when you get a thyroid nodule and you get worked up with an ultrasound. We're going to get a fine needle aspiration and tell you whether part of the thyroid needs to come out. And then the next step after that is to follow it long term. So what does thyroid surgery involve? Well, that's something that as an ENT I do, is to take out half or all of the thyroid. In the past, you would have to take out the whole thyroid, but many times for some of these tumors, if they're small enough, you can take out half the thyroid and that takes care of it. The reason we want to do half versus whole is there are risks with thyroid surgery, and so you minimize those risks by only taking out half the gland. But sometimes if it's a larger nodule, or if you have big nodules on both sides and they're causing compression symptoms, meaning you have trouble swallowing or you feel just uncomfortable in the neck because of the size of the nodule, then we'll take it out. So just because you don't have any suspicious lesions in your thyroid, meaning like a nodule that's suspicious for cancer, you may have a really big thyroid or have big nodules that are benign, but they cause you symptoms. That's another reason to take out your thyroid. So the surgery is done an incision in the front of the neck. It's trying to make it as small as possible, but sometimes if it's a really big gland, in order to get it out, it has to be a bigger incision. These are done cosmetically, meaning in a skin crease, we close them very nicely. They usually heal very well. We take out part or half the thyroid. People often ask, why can't you just take out the nodule? Well, the reason is the things we worry about in the gland would be the nerve that moves the vocal cords that runs along the trachea underneath the gland. And there are two glands that are real tiny, the size of a pea on both sides, called the parathyroid glands that control your calcium level. If your calcium level gets low, you can get numbness and cramping in your hands, and you can also get a heart arrhythmia if it gets really low. So we want to be careful that those are preserved. We also want to preserve the nerve that moves the vocal cord so you don't get hoarseness. That's always a small risk with the surgery. We actually monitor the nerve with a special tube in the airway during the case, so I can also go in and stimulate whatever might look like the nerve to know if it's there and if it's at risk or not. So if you try to take out just the nodule, you're not necessarily able to find the parathyroid glands or the nerve, and you put them at higher risk. And also, anytime that you operate, you cause scar tissue. And so going back in to take out the rest of the gland puts everything else at risk. So that's why you either take out half the gland or all of the gland. Now, if you take out the whole gland, more so than half, you may be on thyroid hormone supplementation or levothyroxine. Many of your friends may be on thyroid hormone because their thyroid gland is underactive. Same thing, take out half, you might need it. But if we take out all of your gland, you're definitely going to be on thyroid hormone. People have been on this for many years. It's safe to do. It's easily to get that at the right level, and you'll do well with that. Most people recover well from surgery, and then they end up sometimes needing to stay overnight if we take out the whole gland, but half, you can often go home. Within a week or two, you're back to normal activity, and most people don't have a lot of pain after this.